They've reaffirmed a fundamental principle that here in America, in the wealthiest nation on earth, no illness or accident should lead to any family's financial ruin.
What the court did not do on its last day in session, I will do on my first day if elected President of the United States. And that is, I will act to repeal Obamacare.
I'm delighted. I'm delighted.
Why should you be forced to buy health care?
It's not going to allow the adversarial relationship where patients withhold things that are important for their health care for fear of being billed or not being able to afford what the treatment is.
So this decision, I want to digest it, but it's a sick feeling in my stomach to think what we have to do to put the Constitution back together.
This is a good day for the American people.
And that's some reaction yesterday. Basically, as I said, the most dangerous place in D.C. was between a lawmaker and a microphone in our nation's capital after that decision came down. And I love how many people pretend like they saw it coming. All right, doctors, patients, and of course, the two men who are vying to sit in the Oval Office, all sounding off here on the impact and the consequences, not just to the general health of this nation, but also to the whole electoral process as we rapidly approach November. Now, our next guest, I'm very curious the perspective on this because we've mentioned already the White House did not let any time slip here but say, guys, go campaign on this. Well, Sean Patrick Maloney, who won an important primary here in the Hudson Valley, he's Democrat looking to unseat Nan Hayworth, who was one of the more vocal opponents of this health care reform in New York's 18th Congressional District. First of all, welcome to the program again.
Thank you very much.
Dominic, of course, joins us as well. And I'm going to start with you. David Plouffe says, guys, go campaign on this. As I said to the Congresswoman, when you go individual item by item, people like the stuff. But when you say overall, what do you like it? They're going to call it Obamacare, whether the White House likes it or not. And 1 in 3 are really buying it. And the other 2 are either don't like it or not sure. Will you really spend your time, limited as it is, pushing this issue?
Well, let me tell you what. First of all, let me just say, because it's the first time I've been on television since Tuesday, let me just say thank you to the people of the 18th Congressional District, especially the Democrats who put their trust in me. And as someone who just came off the hustings, let me tell you what people are talking about there. What people care about is what's going on in their lives. And right now, the middle class and working families are getting squeezed like never before. So when you talk about 3 million kids who get to stay on their parents' health insurance policies for a couple more years, to get out of school, can't find a job, a lot of kids come out of school with debt, you know, that's a big deal. That's a very popular thing. So people like Nan Hayworth want to go back and take that away and kick those kids off their parents' health insurance policies. I think that's crazy. If you talk about kids who've got pre-existing conditions, as that little girl you showed on the segment, you know, my opponent, Nan Hayworth, and the Republicans think it would be a good idea to go back and tell those kids and their parents that it's okay to deny those kids health insurance. That's wrong. We shouldn't do that. Look, when people know what's in this bill, I hear it every day. If it has to do with helping working and middle-class families get by, people are gonna understand it's a good thing.
When people say, though, hey, Sean, I can't afford another tax, and that's what Robert called it yesterday, and I'm a small business owner here, and I got 65 employees, and it's a burden I can't swing right now. You know it's a tough economy. What's your answer to him?
Well, you said 2 very important things. One, anytime you see the most conservative Chief Justice of my lifetime, John Roberts, agreeing with President Obama, then I think you understand that all the other stuff going on outside is a bunch of politics. And so I think a lot of people are playing politics with this, and they're trying to scare people, and I think that's wrong. I think what the court said in a very clear voice, with conservatives and progressives on the court agreeing, this is a constitutional law. So we should stop playing politics, and we should start talking about people's problems. Now, small businesses, you know, are largely exempt from the requirements of this bill. So that's just a lot of scare tactics, too.
Well, if you got more than 50, you're not. Under 50, you're absolutely right. But once you hit that magic number here, now there's some exposure. And if people to this point say, I just can't pay for health insurance, they're some of the loudest voices that have had issues to this point. Are their fears unfounded?
Look, I think everybody ought to take a deep breath. I think when we look at the provisions of this bill, they are going to largely help working and middle-class families, small businesses, all of us who are paying all these premiums. Look, my premiums, your premiums are higher because a bunch of people want to exercise their constitutional right to get sick, get injured, get in an accident, go to an emergency room. There's a federal law that requires that we treat folks who show up in an emergency room. I agree with that. I think that's a good idea. But if you're going to require hospitals to treat everybody who shows up, then my God, we should all be contributing. That used to be a Republican idea until it got all dressed up with this politics. That's a Republican idea.
President gives a call from Air Force One, says, hey, I'm going to pop into Stewart Airport. Maybe at the airport, you and I were going to go do some events. I assume you're going to say, love the company, Mr. President, right? He says, John, what should I talk to the people of your prospective district about? Would you want him talking about health care? Would you want him talking about the economy, jobs? What is the issue you hear? I mean, you went through a tough primary, but now you got a tough general election against a very well-funded opponent. What is the issue if the president came to your neck of the woods you'd want him to hammer and hammer again and again?
The number one issue is that people want to create jobs, they want to grow this economy, and they know Congress is broken and they want to get it working again. They want it working for working and middle class people. They want it working for people who are out of work, who want work and can't find it. And when you talk about issue after issue that this Republican Congress is focused on, whether it's messing around with the full faith and credit of the United States, whether it's trying to take away access to contraception, whether it's doing thing after thing that has nothing to do with solving people's problems. I mean, my opponent, Congresswoman Hayworth, thought it was a good idea to delay disaster relief to her own neighbors after Hurricane Irene. Now, that is so extreme. When I go around the 18th Congressional District, and I go around Orange County, Westchester, and Putnam and Dutchess, what people say to me is, stop fighting, start working. Get Congress working for working and middle class people. We're sick of the games, we're sick of the politics. That's what I'm going to Washington to do.